Welcome to everybody who's joining via Zoom and on Facebook Live to reporting and COVID-19 conversations for journalists. This is the first installment in a whole series of these conversations, which will be sort of half webinar, half coffee meeting. With a variety of subject matter experts, journalistic innovators, and others who can help us as news professionals navigate through this unprecedented and extraordinary global crisis. I'm Bruce Shapiro, Executive Director of the DART Center for Journalism and Trauma, a project of Columbia Journalism School in New York City, supported by the Kenneth B. Dart Foundation. This whole series is sponsored as well by my colleagues at Columbia Journalism Review. We are going to talk today in this first series about reporting on coronavirus and COVID-19 at the local level. We're lucky to be joined today by my friend and Columbia University colleague, Dr. Irwin Redlener. Dr. Redlener, or Irwin, is the director of the National Center for Disaster Preparedness at Columbia's Earth Institute. He's a professor at the Mailman School of Public Health and a specialist in pediatric medicine, and also the founder and president of the Harlem Children's Fund.
Yeah, Children's Health Fund, yep.
Harlem Children's Health Fund.
No, not Harlem. Anyway, yep. Children's Health Fund, okay. Yeah.
And I've asked Irwin to come today and talk with us because while the coronavirus crisis, both here in the US and around the world, is being covered and reported as a global pandemic and as an issue of national leadership and national policy, for those of us who are local reporters, local journalists, it's very much a community story, a municipal story, a state story, or a regional story, which has its own dynamic and its own needs. We're going to talk through some of those with Irwin today. We got 45 minutes here. He's got another commitment, so we'll do a hard stop at a quarter of the hour. And I will start out by having a little bit of a conversation with Irwin on these things, and then we'll open it to questions. To ask questions, I'm going to ask you to use the chat feature on Zoom, which means those of you on Facebook Live, unfortunately, won't be able to ask, but the many of you on Zoom will be able to. Also know that this session, as will the rest of the sessions in the series, is being recorded and will eventually be posted on the Dart Center website. And we're also going to try to create tip sheets and other resources for journalists off the back of this. I'm going to get right to it, Irwin, since our time together is limited. You know, the coronavirus crisis that has all of us speaking today from our homes and other places we're holed up is this sweeping global story, yet it plays out in particular ways at the local level that have a lot to do with the job of local reporters. Talk a little bit about how you see the local nature of the pandemic and response to it, and what you think reporters ought to be paying attention to.
Sure, thanks, Bruce. So this is a very odd time in America, and that's no secret, obviously. And one of the odd things about it is we're confronting a very deadly, growing biocrisis in America, and call it a pandemic. And we're part of the world community that is trying to cope with this. The coping part of this is very, very complicated, because at every level of government, starting at the top of the American government and the president, and of course down to the states and the cities, we have policies being suggested, information being given, and at the end of the day, those policies, as they seep from on high in government offices, in planning rooms at whether it's the White House or the local your local mayor's office, those policies have to get interpreted ultimately in ways that manifest in local communities, very local communities, and beyond that, even manifesting with the life and expectations for every citizen. It's a very unusual situation because typically, and even in any kind of large-scale disaster, whether it's Hurricane Katrina or any other hurricane or volcano or whatever it might be, this is local, but it's local in those very communities. Now we have national policies seeping down through states and cities that have implications for every single community in the United States, without exception. So although there's disparate spread and outbreaks, so some communities experiencing more, some less. New York State and New York City has, of course, become recently the epicenter in the U.S. in terms of numbers of cases, number of hospitalized people. But that has to do with the healthcare system, which I'm happy to talk about later, including what it means for your local healthcare system. But first of all, we should acknowledge the fact that we have rules now and regulations. They're gone beyond recommendations in most places where, you're sheltering in place basically. And you may be sheltering in place for many months. I think to talk about this as a matter of, a couple of weeks or 3 weeks is not accurate from what we know right now. So what we're going to talk about is actually the experience of people in all of your communities as they try to cope with what's going to be necessary to so-called flatten the curve, which basically means reduce the peaks of cases that come up every day. I don't think we're going to be able to influence much the total number of cases unless we had much more stringent measures in place a long time ago. Right now, we're just trying to, in effect, reduce the impact on the healthcare system. So, and it's very, very local, even though it's very, very global as the big picture.
So at that local level, I mean, a lot of us as reporters have spent time in our careers covering local communities and local government. What do you see as the kind of key points of interface in local government that are particularly important right now for reporters to attend to? And this is true around the world. This isn't just true in the U.S.
Sure.
Acknowledge there are reporters from all over the world on this call, but there are American wrinkles to this. But while clearly we keep talking about all government responses and so on, there are particular agencies that are carrying a big burden now and that are worth developing sources in. Who do you think of?
So here's the way I would approach this. So first of all, I'm assuming that journalists are going to all the relevant press briefings by public officials, because that's where the policies are going to come out. Behind the scenes, of course, there's been lots and lots of discussions theoretically with public health leaders, people that deal with transportation, the economy, sanitation, everything. And it all comes out in a status talk that's usually given by a mayor or a governor. Mm-hmm. And in that, they conclude with recommendations. And I think the reporter's relationship to those local officials is really very important. Like, what kind of questions are being asked? Because you're going to be the mediators, obviously, between the policy declarations and really not so much on the federal level. It matters what the mayor is saying and the governor of your state is saying. But you're the, as you always are, the mediators between the official statements and what that actually means for citizens.
And which local officials in particular? So I'm talking to you today from New Haven, Connecticut, where I live, a city of 120,000 or so. If I'm reporting on New Haven, which are the departments and agencies that maybe I wouldn't think of off the top of my head, but in any event that should be on my check-in list, on my source development list, put them in the middle of the story list?
Right. And by the way, every community may be a little bit different about who the lead players are and what they need, who's thinking about what. But let's just say, for example, that under all circumstances, you want to hear about what the local health commissioner has to say. And what are they talking about? Or what are they transmitting information about with respect to, how infectious it is in their community and so on. And also, most importantly, is what's happening in the healthcare system in your community. Mm-hmm. So in your situation, Bruce, what is New Haven? What is Yale doing? What are the other medical centers doing? But also, besides the hospitals, you have a lot of doctors in private practice. And you have clinics that are not necessarily part of the big institutions. And I would be looking at those places as well.
So and community clinics that deal with vulnerable populations, for example.
Well, not only with vulnerable populations, but let's say there's a Kaiser health center there, but vulnerable populations in particular, because vulnerable people have much bigger impact of a lot of these measures that are being taken than people who are more affluent or more economically stable. So I think dealing with relevant public officials like that is important. By the way, you also want to know what's happening to sanitation service. Are guys still picking up the trash? And what limitations are there on that? And there are some very practical and very local issues that will reflect on how well life is going to proceed as some version of normal, or what is the new normal that you may have to know about. And all of these things, I'm telling you, just listening to a press conference by a mayor or governor for the average citizen is extremely difficult. And the messages are going to have to be interpreted. They're going to have to be, focused in on, and, made sure that you, as journalists, are reporting the essence of what people need to know out of it. And it may be very complicated. There's things like, are people getting treated with any kind of medicine maybe they've heard about in the news? So are hospitals and health centers in your community using chloroquine, which is a medicine for malaria that's come up a lot? The president's been touting it. It is, let's say it isn't, because local health officials don't agree with it. I think it's worth spending some time saying why they're not, and why they're not has to do with horrible, research backup to support using it, even though the president's been just going on and on about it. But, for example, in New York State, it's also been sort of taken up as a possible strategy. But I think it's good for the reports to dig into it. Why are we, or why aren't we doing whatever other people might be thinking or saying about this?
So in addition to developing sources and the government agencies that are really at the coalface of the coronavirus response, if reporters and editors are trying to look in their own communities for indicators of people doing well, indicators of resilience, or indicators that the wheels are about to come off the car, that things are headed in a very bad way, what would you say are the really important baseline indicators, whether it's in actual medical issues or in other social issues, that we should be tracking over the next few months?
Right. For a long time, people like me were saying publicly, we have to find that sweet spot between complacency and creating panic, which of course is very germane to how things are reported. Lately, I've been saying that, kind of, but there actually is panic in the healthcare system, for example. They're running out of personal protection equipment, masks, and so on. And that requires a level of intensity in terms of reporting what we're saying about that is different from what the message is that we give to the general public. This is tricky for journalists because the public is so far doing pretty well. There are issues that will be specific, and the wheels will come off the bus. Is that the right expression? But the wheels will come off
Close
something.
enough.
Yeah, I'm thinking wheels on the bus. But anyway, so in the specific question you're asking, Bruce, I think the wheels are coming off the healthcare bus. They're falling off. There's two of them are already off. But the other things that we'll be looking for in the general public, how well are we adapting to children not going to school? Lots of local stories about that. How well is your local school system doing in terms of providing alternate methods of teaching, including remote teaching in places like New York City or New Haven or LA. I mean, there's lots and lots of people who live in poverty or in some sort of economically fragile family environment. I'm not so worried about the middle class and above kids having access to computers, knowing how to use them, and being easily brought into the world of remote teaching. But for children whose families may not have a computer, may not have that kind of experience, may not have parents that are that familiar, it's tough. And I think I would keep an eye on those families very, very closely. They're having a different experience. There's many households where grandma or grandpa is living with people in a relatively small living quarters. They are at very, very high risk. And the kids or younger people may be carrying the virus. How are people managing to keep those people and their families who are really at serious risk,
Hmm.
how are we keeping them out of harm's way as much as possible?
Hmm.
And these are very, very local issues, and that will differ from community to community. Are the functions that are needed in your community around, let's say, feeding programs for kids that are not in school but ordinarily be getting free lunches, social service programs, child protection agencies, and every one of the local agencies that's part of normal life is potential material for you guys to dig into and try to get a handle. And by the way, just the fact that you're digging into it, it's not just a passive reality. As you know, that the more you dig into things that where we need improvement, that's the kind of attention that brings action to improve whatever it is. For example, the educational piece, or you can't shut down child protective services, but they have to be making home visits. Are they handling that? And so on.
Yeah, and I also imagine that there are other public health indicators that may be less obvious, for example, intimate partner violence or other kinds of things that we might
Yeah.
want to watch in this period. Anything come to your mind in that zone?
Well, first of all, we may have very steep increases in domestic violence of all kinds, including child abuse and partner violence and so on. That will emanate from the stress of having to live in sometimes very tight quarters. You know, families aren't used to being together like 24/7, which they are now. And there could be potential dynamics which would be worth tracking about the exacerbation of stresses and tensions that will lead almost inevitably to an increase in interpersonal violence in that particular household. And you can imagine how that could happen. But is your city or local community ready to handle that kind of new pressure to deal with these issues?
Do you know offhand if domestic violence shelters and other intervening agencies have plans in place for this, or is this something that folks are having to improvise around?
Well, I think there's guidelines that the various agencies or associations of agencies have been putting out. How much they're adhered to, how much they're able to actually adhere to recommendations, I don't know, but it's another really good line of inquiry to keep in mind as you're trying to figure out what you're going to cover in this story.
I'm going to start asking some questions that reporters are chatting in, and if you're on the Zoom call, use the chat function, please, to send questions in. We'll do our best to filter them. I'm going to start with a question from Jeremy Redmond, a wonderful reporter and friend at the Atlanta Journal-Constitution, who asks, could you address the vulnerability of immigrants and refugees in America during this pandemic? How do you see this issue
Yeah,
playing out in particular for those communities?
an enormous problem that has been exacerbated by 3.5 years of the Trump administration's attitude towards immigrants in general, and especially ones that are coming across the southwest border, who are now terrified to have any sort of official contact. Even going to a clinic is a challenge. There's this now chronic fear among immigrants that they're going to get deported. That fear is not just from people who came across illegally. It's a general fear of even people who came across legally, that the environment is not a good one. So here we're now having this sort of extraordinary challenge of this pandemic as it's manifesting in America. We want people to come in early to be able to call a doctor to figure out whether they need testing. If they get very sick, we want to start treating them earlier, sooner rather than later. But the environment that has been created with respect to immigrants and the 13 million people who are, unauthorized immigrants, that is a major, major problem. And in fact, it's not good for the whole country to have people who actually are fearing, legitimately fearing for what's going to happen if they do get identified by officials. So this is something that has to be worked out. And if you are in a community, I don't know what it's like in Atlanta, but if you have a community where there's a significant population of immigrants, I think there actually is in Atlanta. It'd be really great for journalists to keep track of that.
Do we know anything about either the spread of COVID-19 or the preparation of the facilities where immigrants and migrants are in detention awaiting processing? What do we know about where this pandemic fits in with those
Yeah.
settings.
So having spent some time working with the government on policies that have to do with exactly what you're talking about, the medical staff supporting Homeland Security and the Customs and Border Protection Agency and Border Patrol, the medical staff there is actually quite competent, and the people who lead those efforts. So I know they've been working very, very hard to try to make sure that people are identified early that have potential symptoms, and they're getting the proper assessment and treatment. But that is, I think, pretty much a fact. But for those reporters who may be calling in from those areas around the border where there are lots of people in detention, I think it's worth pursuing, of course, exactly what's happening.
I'm going to ask a question that Jennifer Karchmer is asking about how are leaders advised now on communicating with the public? You've now been doing this kind of work for a long time with public officials. Leaving aside the idiosyncrasies of the current tenant of 1600 Pennsylvania Avenue, what's your impression that public officials, whether it's mayors, governors, ministers, whatever, how are people being advised to communicate in this? What is the balance of terror and calm? What's the balance of information versus information overload? How are officials being advised, do you think?
Well, very poorly, and it starts at the top. I don't think the president is actually he may be advised, but whether that advice is actually being absorbed is not clear. And I think it's no secret that he operates by himself through Twitter, et cetera. But even at the press conferences, he says things that are flat wrong, and 5 seconds later, Tony Fauci will come up and literally correct the president.
Yeah.
This, by the way, and this is a really big problem, and it sort of again seeps down below the White House, because there's confusion about the messaging coming out of the White House as it applies in the states, which is why a few weeks ago we had the mayor of Seattle saying no crowds bigger than 250 in any one place, and then New York City saying it was 500, and some other place saying 100, and now of course it's down to 10 or less. But if you don't have actual direction that makes sense coming from the top, that is a problem that gets transferred down to lower levels of government, and it's not clear how to do that. And I'm sure, like I said, I'm sure the president and every level of government, like mayors and governors, are getting advice, but at the end of the day, they're really sitting on center stage and doing what they feel is right after getting the input.
Given all of the risks of associating closely with people and of the need for social distancing, if you were a local reporter, again, let's say in New Haven, where I live, or could be in Dublin in Ireland or anywhere else, if you're a reporter trying to be diligent and do a good job, how would you advise we go out and report beyond using Zoom and telephone as much as possible? But if we still feel we need to be a presence in the community, what should we be doing to keep ourselves safe, and what do you think are reasonable guidelines to help the public get the story without putting ourselves at excessive risk?
That's a tough question, actually, Bruce, and for the obvious reasons that I'm trying to stay in. I'm in a risk group, and I'm trying to stay in my house. Like literally, I do a lot of TV, and I have a little remote TV studio in my office at home. But it's a very, very difficult question that you're asking. So if I'm a reporter and I want to cover how things are going at the hospital, I can't do that by Zoom or Skype, or I have to go there. And I think for reporters, keeping your distance, the 6 feet distance, I wouldn't go by by public transportation. I would take drive or get a car service, and if you get a car service, bring some surface wipes with you so that you can wipe off the handles and the armrests and so on, and do that. unless you're actually going to a hospital and observing how patients are getting cared for, I don't think you need a mask particularly, but you do need your hand sanitizer and a lot of frequent hand washing and trying to keep your distance as much as possible.
If there are reporters here on this call who are trying to measure their own community's response and are looking for examples at places that have at that level done it right, to the extent that anyone has, where do you think we should be looking? Where's the sort of compare and contrast?
So you're asking where have we done a good job?
Either if you were looking around the world, since several countries, China, Italy, elsewhere, have already had this wave, the first wave of coronavirus. We kind of have paid attention a lot to the catastrophic examples and to maybe the writ large big examples. Okay, Singapore and South Korea did their thing. At the local level, how do these best practices play out? What do you see as characteristic of local response in the places that have?
Well, unfortunately, we really got a very, very late start with testing.
Yeah.
Without testing, you don't know what the prevalence is. And if you don't know what the prevalence is, since most people are very asymptomatic or minimally symptomatic, certainly in the beginning, it's hard to answer that question. We, to the extent that we had a really big problem in getting reliable testing equipment out and developed and distributed, we did a horrible job. And as of a couple of weeks ago, it's better now, but we were testing like 5 people per million of the population. South Korea was testing 3,700 per million of the population. So they knew a lot more than we did at equivalent stages here. And so a lot of it's been basically kind of guesswork, looking at what's going on in other countries. But that is a really, really enormous problem. So, it's just hard to know which places are doing the best. I mean, the places that did very early aggressive social separation, closing schools, limiting crowd size, et cetera, much more than we generally tend to do them, those places would tend to do better.
Another question that's come in on the chat, all of us as reporters, whether we're local reporters, global reporters, and everything in between, are dealing with this constant barrage of misinformation, of genuine news, and of noise. How do we do our work as fact finders and storytellers and responsible citizens in the midst of this? And maybe let me actually make it personal to you. How do you protect yourself? How do you do your work with all of this kind of adrenaline pumping misinformation coming at you and a lot of other stuff? How do we keep focused, stay calm? How do we deal with misinformation?
So since I do, I'm working in this field, it's not typical, but let me tell you, so I am at risk personally by age and pre-existing conditions. So I'm pretty obsessive about staying in the house.
Yeah.
But in terms of the information issues, and one of the things that journalists should know, first of all, you need to be able to use Google, and you need to be able to be, very careful about what sites you're looking at, the information you're getting. But following the major news services, national news services, it's, and what's coming out of WHO, and especially what's coming out of the CDC in terms of guidelines and all that. But I think you'd be well advised yourselves, but also for your readers, to keep steering people away from, social media to get information. That's the most unreliable and the most BS, the most misinformation comes across the social media platforms, which more and more Americans are entirely dependent upon for all information, news and otherwise. So there's already a built-in comfort level of the general public, especially maybe the younger general public, with whatever it is they read online. Doesn't matter where it's coming from. They have no way of judging or often caring about the sources of the information. And my advice for journalists is to keep reminding people that if you want accurate information about what's going on, go to the CDC site. I think it's coronavirus.gov.
Here's
But
a
yeah,
here's a real local reporter question. I love this one. That's come in on the chat. Even with good social distancing, people still go out to stores to get their food. And I've noticed
yeah,
even here in New Haven, I've been in 2 different grocery stores in the last couple of days. One of them really was enforcing social distancing, and one of them was not. And I had to wade through a crowd of
yeah,
teenagers. Do you do you think there are particular policies that local governments or regional governments
sure,
should be paying attention to
absolutely,
with this?
yeah. By the way, wading through a crowd of teenagers, it's like, okay, I'm sorry about that, but anyway,
Right.
but a crowd of anybody actually. So here's the thing about this. This boils down to a reality that we're dealing with. This is not just something for government to deal with. This is for individuals, it's for private businesses, and we haven't had enough collaboration around that. So a responsible manager of a grocery store doesn't allow more than X number of people
Yeah.
in the store at any one time. Yesterday we had to stop at a drugstore. I didn't go in, but Karen went in, and there was a security person at the door, says you have to wait for somebody else to come out because they were stringently limiting the number of people in there, and that's not a government order. That's a store manager or a store chain or whatever it is being responsible and doing their part to help quell the spread. And it's a great local story, and I agree with you.
Yeah.
It's like, how well are the people that own businesses, or or the people in the position to limit people gathering together
Yeah.
more
Yeah.
excessively than they should. But that's a great story. It's like what, I went to 5 supermarkets today.
Yeah.
3 of them had control of the number of people inside.
Mm-hmm.
2 did not at all. And by the way, even inside the store, there are some stores that are measuring out 6 feet
Yes.
on the floor by the cashier. I don't know whether you experience this, and
Yep.
you have to stay at least that 6 feet away. But they've also taken the effort to measure that out and put the markers on the floor so people know where to go. So this is all not going to work, in fact, unless there is local compliance and buy-in by the vendors, by the shopkeepers, by local officials. But we're all in this together right now. It's a cliche, but it really is the fact. This will not happen by government edict alone. There's no question, Bruce. It's a really good question.
Let me pass along more of a global question, since you also have done a lot of international disaster work. In Africa and Latin America, the number of cases have, at least confirmed cases, have been small. A, do you think that is the case, or it's just an undercounting? But B, in particular, how should we be thinking about those in long-term crisis areas, refugee camps, and so on? What's going to happen there?
I actually wrote an op-ed in the Washington Post about this very question a few weeks ago. And basically it started off talking about the increasing violence and danger from warring factors in northern Iraq. And northern Syria. In Syria, the war continues big time, and the government's invading and killing civilians and also disrupting the healthcare system by destroying hospitals. What I postulated was that given this deterioration of the general situation in this war zone, what happens when COVID-19 becomes a factor also? It's unimaginable. But I think we're going to see in a lot of communities in Africa and Asia, war zones, etc., even places in severe poverty and huge ghettos that we have all over the world. It's almost inevitable that COVID-19 is going to be an issue in these places, and how to manage that is, it's very difficult to wrap one's arms around that. But it's a nightmare dystopian situation we're talking about with people that need treatment, need evaluation, and are not getting it. But all these places that are still reporting low numbers, like countries in Africa, it's a combination of not doing testing, not having other facilities. But whatever it is, I can't see those countries being protected or immune from this.
Here's another real local reporter question from the chat, and then you can answer that. Then I'll ask one more, and then we'll let you go. We've heard a lot about the problems with ventilators and masks and those kinds of supplies, but public health departments, what do public health departments, local public health departments, what kind of resources do they need to be dealing with this pandemic over the coming months? Do you think, whether it's in the US or around the world, they're adequately resourced? And how should we be thinking about those kinds of frontline interveners, not just the treating doctors and hospitals?
Very important question also. And the problem is that the funding for local public health departments has been diminishing. They're being starved by cutbacks, slowly but surely, every year, facing cutbacks and reduced staff. Because, you know, we look at something, a particular year's budget, and, you know, nothing that much has been happening. Or here's a place where we can save money, and we cut the budget. Except that when we really need it, it's not there. You know, this is very similar to just-in-time manufacturing and you know, warehousing and all that. So, as opposed to managing the expenses of huge warehouses with massive amount of supplies, stores will get as little as they can get away with for a few days worth, and then just order more. And that just-in-time, by the way, has an effect even in the pandemic, because the supply chains for the protective equipment and stuff such that we need has also been just in time, as well as our attitude towards the local health departments and their ability to stay fully staffed. And it's a big problem. And, you know, do you buy life insurance or not? Do you have, you know, you want to buy, if you could get away with it, would you not buy car insurance? Because the likelihood of your being in a serious crash with injuries and so very little.
So maybe one worthwhile story for a starter is simply to look at recent funding decisions about local health departments, look at the staffing of local health departments, and try to deal with kind of local capacity stories on everything from restaurant inspections to all the many things that public health departments do.
Right. So it'd be really interesting to find out that what was the status of your local health department in November last year, October, before this pandemic erupted. Were they at that point concerned, and I bet you they were, about their funding levels, their ability to keep up staff to do their routine functions? And there's no doubt that they were having problems before that. So now here comes the big one, you know, that we all been, you know, sort of minimally thinking about, but knowing that it could actually happen, and now we have it. So we're paying a price for the financial economic starving of our local agencies. And again, it's going to be very, very different in community to community, and very much worthwhile delving into from a reportorial point of view.
All right, let me ask you one other thing, and then we'll let you go. If I'm a local reporter and I'm looking to balance out terror and balance out worry and anxiety and confusion with some stories that realistically show coping and resilience, that maybe show my own community what some of our members are doing, and where should we be looking for stories of coping and resilience alongside the drumbeat of crisis?
This is a really great question also. And here's what I think about this, that where specifically you'd find a family that's doing fine, I don't know, but the reporters would know that better than me. But I would try to, let's say we're going to do a story in that for your local community, and you wanted to show how people have been coping. I would show people from different, let's say, socioeconomic strata, how people cope, and not try to, or not inadvertently say that, you know, you got to have a lot of resources, and you know, Mr. You know, multimillionaire is making do in their, you know, huge building, their apartment or house or whatever, but how average people are making do. And there's all kinds of interesting things that people are doing. For example, families are together now 24 hours a day. And one of the things that actually my wife recommended to our children and our grandchildren is have a schedule. Kids wake up in the morning 8 o'clock, they're going to have the first school lesson, or after breakfast, and so on. There's going to be a break, like a recess, and going to be lunch. We're going to come back, or maybe we'll go for a walk. But developing a routine for the family, for example, and having the kids participate in planning for what they're going to do for the next day and how they're going to be occupied and so on. These things are wonderful. People need to read those stories so that those that are despairing, have no idea where to start, are seeing something, well, oh my good, that's inspiring. We could do that in our family.
Yeah.
And I think that's part of the good news part of this, is that, you know, Americans are going to learn to, like other countries, we're going to learn to adapt to crisis a whole lot better than we ever thought we were needed to. And I think that may ultimately be one of the more positive things that comes out of this entire experience.
Well, I think that is as good a place as any to wind up this conversation, even though I know there are many more questions. But I want to thank, first of all, everyone who chatted in a question, everyone on the line. I also want to thank Kyle Pope, the editor of Columbia Journalism Review, and his colleagues who co-sponsored and co-promoted this thing. My colleagues, Kate Black and Ariel Richen, who have produced it. And most of all, Irwin, thank you for sharing this for the last 40 minutes or so. I think you've made a significant contribution to how local and community journalists in the US and around the world will be looking at their work over the next few months.
It's a pleasure to do this. It's great. It's a great, went very fast. And if anybody wants to ask me specifically anything, either getting in touch with me through you or directly to Columbia, I'm very available to journalists. And
excellent.
You desperately need it right now.
You may live to regret this. You may get a lot of
requests.
No,
I won't. But I can take it.
But okay, and thank you. And
right,
again,
guys,
for those on the line or those watching this on video, www.dartcenter.org is our website with lots of resources. You can also find us on Facebook and Twitter. That's all for this introductory series, introductory episode in our reporting and COVID-19. I should say the "and" in that title is important because we're going to do this every Tuesday and Thursday. And from my perspective, it's not only about reporting on coronavirus, it's about how we continue the other work of reporting through this crisis. We'll be addressing all of those questions. Coming up on Thursday, Florangela Davila, the news director of Seattle's public radio station, who will talk about how her colleagues handled it when the coronavirus wave hit their community. Thank you all.